My name's Ciaran and I'm currently a student doctor in the UK. I first took the MHFA course, I believe it was 2021, so it was just after the lockdown, the first lockdown lifted. The reason I took that was because we'd just come back to school, and at the time I was in sixth form, and I could really notice the impact that it was having on my peers in particular. So obviously being such a young age and having such a large amount of developmental time disrupted, it was really quite worrying to see how people were reacting to the isolation. That sparked my interest into thinking, right, I need to really improve my literacy in mental health in particular, so I'm able to kind of understand how people are feeling, and if there's anything I could do at that time to help or make anyone's life easier, then that was my motivation for taking the course. So I've grown up in a household, my mum's always, she's a nurse and she kind of specialises in mental health in the workplace, and I've always kind of been brought up with, it's okay not to be okay, and the ideas of the 5 ways to wellbeing and how important it is to look after your mental health, and that it's just as important as your physical health. And I think especially when I was getting to that age of kind of 15, 16, 17, I was really starting to see that in practice. I was seeing my peers at school struggling with anxiety. Some of them were taking time off because they were depressed, and often with many things, if you don't see something on a day-to-day basis, then you kind of you think, oh, it's not going to happen to me, or oh, it's not affecting me, I don't need to worry about it. But I was really, at that point, I was in a small school and I was thinking, I'm seeing these on a day-to-day basis, so this is a very wide problem, and it's something that I could really get my teeth stuck into to try and make a difference. I've just finished my 3rd year of medical school, so I've been in the hospital pretty much full time now for a year, and it's really been quite eye-opening to see the challenges that NHS workers of all specialties, not just doctors, that I've been spending time with, but also the nursing staff, the porters, the cleaners, everyone is under such immense pressure. I've been working in a major trauma centre in the Midlands, and it's in the top 10 biggest hospitals in the country, so we've got over 15,000 beds, and especially over the winter times we had 2 black alerts, we were at maximum capacity pretty much all the time, so it was a real struggle on a day-to-day basis to firstly manage patients' expectations, but to also just try and battle against the tide of ridiculously long waiting times, and that inevitably takes its toll on the staff. So I think burnout is a massive issue, again, fully healthcare wide, not just doctors and nurses. Dealing with a vast amount of patients, and then seeing some quite horrific things at times, people passing away unfortunately, and then having to next minute go to the next patient and try and have the same level of care is nigh on impossible, especially with the lack of support that there is out there. And I mean, I read a statistic last year, and I won't go into which hospital it was in particular, but I read an article and it was of 3 doctors that ended their life in that particular hospital trust, and I just thought that was absolutely shocking, and 3 is 3 too many. So I kind of noticed then that there was some real need for change, particularly on my career path. So that's why I decided to try and campaign for mandatory mental health first aid training in medical school curriculums, to try and upskill the incoming and future doctors to be able to spot the signs, not only in patients to identify where support's needed, but also to look out for each other, because I really think there's a lack of structured mental health support services, especially for healthcare staff. So that was something that I was really passionate about and thinking there's a real need for doing here. So that's a project that I'm currently working on at the minute. And in April, I went down to the BMA house with the rest of the medical students committee that were all selected at their respective medical schools, and it was voted into the agenda. So the BMA will now be taking that to the government and the General Medical Council to hopefully lobby for that change. There's challenges in all aspects of life. It's not just healthcare staff. Everyone struggles with their mental health at times, and I think that is something in itself that's massively stigmatised. Everyone at some point in their life will most likely experience some kind of ill mental health or poor well-being, whether it's lifestyle circumstances, or whatever it may be, financial pressures. I think mental health first aiders are really important because it's not about being a psychiatrist, it's not about being a doctor, it's not about being a therapist, it's about being a first port of call in the community. So the more mental health first aiders we have in the community, the more likely we are to pick up on people that need support. So the more walks of life that we have mental health first aiders, whether that's in construction, whether it's in banking, finance, whatever the industry, or even if you're just at home, supporting your local community, your neighbours, your friends, it's really important because everyone needs support at times. And the more mental health first aiders we have out there, the more people they have to reach out to, the more people that there is trained in these really important skills to be able to spot people in mental distress, the more tailored the support can be to them, the more efficiently we can allocate these support resources, and there'll be a better scaffolding for support out there. So this was a student that I came across, and they were in the preclinical years, which are the first 2 years of the medical degree. And often a lot of students find it very difficult because it's very lecture heavy, very content heavy with regards to anatomy, physiology and things that really no one's come across before. So there's a lot of studying involved. And they were very concerned and very worried, and there was a lot of anxiety around failing exams. Firstly, because they were just struggling with the amount of content, and secondly, because they had some family issues going on at home, and they didn't feel safe at home. They felt as though they didn't really know where to go, and they didn't know who to talk to. So I'm very pleased that they felt as though they could reach out to me, because they knew the work I'd done with regards to promoting mental health literacy and advocacy in medical school at the time, and using my skills from the course. I knew like the Hub of Hope and other organisations that could help, and I also signposted them to contacts within the university. And since then, they've got back on track with regards to their grades. They've passed into the next year of medical school, and they're really in quite a good place now with monetary funding to help support accommodation and living costs, which again took a big burden off them, but also with regular counselling and psychotherapy to be able to help with what's going on, but they're in a much better place now. And I thought as though if I hadn't taken the course and I hadn't really learnt about the different resources that are out there, the typical layperson wouldn't know where to signpost these people to, but there are these amazing organisations that are really at the touch of our fingers, but without having any kind of training or without anyone telling us, we just don't know that they exist. But they're there to be used. So again, that was another reason why I thought the course was really important, because those kind of organisations are just at my fingertips now, and I know about them, so I'm able to pass them on to others. So absolutely, I think this is a really good question, and quite frankly, I could talk about this for hours. It's really important for each of us to self-care. I think that's actually one of the most important aspects of looking after our own mental health and well-being is self-care, and I think quite often that's the first thing that goes wrong when people start to struggle with their mental health. We neglect ourselves, and whether that's to look after other people or just that we don't have the bandwidth. So for me personally, I really break my week down, and I think about, right, when am I needing to go to the hospital, when am I needing to study, and then what time do I have left over? And I really try and protect time every night if I can, to have some time to think, right, what do I want and what do I need? Even if it is just relaxing, having a shower, watching a bit of TV and getting an early night, that is still self-care. It can be as little or as big. I'm quite lucky that I'm quite close to my family at medical school, so I'm only around about an hour away, so I go back home and see them on the weekends, because for me it's really important to keep those connections and keep those networks. And also I feel really lucky that I'm part of an amazing football team, and I'm friends with a lot of my teammates outside of football. So for me, networking and keeping those connections is really important. Also for me, I'm a big sportsman. I love going to the gym, I love playing football, and also I'm a DJ as well. So anything that helps me to switch off, I really try and factor into my day, particularly exercising. Try and do some form of exercise every day. If it's not every day, it's every other day, going to the gym or playing football or doing something, because I feel as though it really blows the cobwebs off me and gets the blood pumping, which is really good for my well-being. And when I'm studying and when I have to work, I just make sure that I'm being sensible. I'm drinking lots of water, I'm eating healthy food, and I'm not skipping meals, and I'm taking regular breaks when I'm studying. Those are the things that keep me sane, really. That's how I look after my mental health, which is really important to be able to work sustainably in any avenue of life. I think self-care comes under a lot of different avenues, and everyone is an individual and everyone is different. So what everyone needs to feel happy and feel relaxed and comfortable in their own skin, in their own life is totally different. For me, if I was to give one self-care tip, it would be taking the time to reflect. If something bad has happened at work or at home, just take the time to reflect and go, this is what's happened, this is how I'm feeling, what am I going to do about it? Because often we're going at 1,000,000 miles an hour every day, and that's not sustainable. We need regular check-ins with ourselves to think, okay, how am I feeling today? If I'm not feeling on top of the world, what can I do to change that? Because, life is full of ups and downs, but we need to be able to find a middle ground sometimes. I think having those regular check-ins and reflections is the most important thing for me. And then you can do whatever floats your boat thereafter. But though making sure you're keeping tabs on yourself is the most important thing for me. I'm really glad I did take the course in 2021, because the course was really good in the respect of whetting my appetite to how we can be a bridge to further support, understand what different mental health issues are, why people struggle, and how to reach out to someone. Because often, that's the most difficult step, is that initial one. So that was my motivation in taking the course. I wanted to try and see how much of a difference I could make, and see if there was anything I could do further to benefit my peers at school at the time.